Okay. I know that the doctor and the RN have been in earlier um, to go over some information about your surgery in the morning, but I'm just gonna go over them one more time before you come back in the morning. First of all, you're having a laparoscopic cholecystectomy, which is basically having your gallbladder removed. Um, you will stop eating and drinking 4 hours before your surgery unless you take any medications, which according to this, you do not. So in the morning when you get here, I see that you told the doctor that your mother would be bringing you. You will come in, we will get you all of your vitals. We will make sure that everything's normal. Once it is, we'll go ahead and get you ready and take you to the surgery area of the hospital. You will basically strip down to just the gown. If you have any jewelry, you need to take it off. You can't have anything metal on you. You need to bring a change of clothes just in case anything were to happen during surgery that requires you to be hospitalized. But typically, this surgery requires very little um, maintenance afterwards. You can, as soon as you can show that you can keep food or water down, typically liquids, um, you're allowed to leave. So it is an outpatient procedure. There's relatively little complications that come with this surgery, but there are a few. So I'll just give you a rundown how the surgery goes and then the complications that could possibly happen. So once all your vitals and everything are completed and done, and they're going to take you in your hospital bed, they'll take you back to the pre-op room where they will go ahead and put an IV in your arm, and then they will give you medication. That's anesthesia through an IV in your arm, a vein in your arm, and that will put you to sleep. You won't know anything that's happening. They will then put a tube down your throat to help you breathe. The doctor will make 4 small incisions in your stomach on the right side. Sometimes there might be 5. It just depends on if he needs that extra little incision or not. And then put a tube with a tiny little camera inside, and he will go in and remove your gallbladder. You'll have stitches in those little incision spots, and those with any type of breakage in the skin can possibly cause infection. One of the major things you need to watch for after surgery is that you are keeping your stitches in the wounds clean and dry. It'll be about 24 hours or so before you should take the bandages off and clean them and then re-bandage them. The best way to make sure that you don't get an infection in those is to keep your hands clean at all times before and after you are doing your dressing change. If it's someone's helping you do it, you need to make sure that their hands are clean. You'll use like a cotton swab to clean around the stitches themselves, and they'll be taken out in 7 to 10 days. The surgeon will tell you after your surgery, or tell your mother when you should come back to have the stitches removed. But you need to make sure that it stays clean. You need to look for signs of infection on the gauze pads, any sort of drainage that comes from any of the incisions. If it's yellow, extra bloody, if it seems to be more, if it smells, if there's redness around the incision that's not just from the incision itself, you need to notify your doctor. If you're starting to get a lot of pain in that area, you need to, let us know. It does not take long for infection to spread. So as soon as you think there could be a problem, or if your mom thinks there could be a problem, you need to make sure you let somebody know, because once infection gets into the blood, it can be a lot harder to handle, to take care of. So make sure that you're being diligent about keeping it clean. And if you have any questions at all about anything, you just need to make sure somebody calls, and we can get back to you and let you know what we think you should do. Pain management after your surgery, the doctor will give you something, probably a prescription for something. Um, Sometimes it, depending on, if the surgery went right or not, laparoscopically, it's not as big of incisions. So typically that can be handled with just for 4 or 5 days of some sort of pain management that the doctor will prescribe. And then from that point on, you can take Tylenol um, to manage the pain. Um, sometimes sometimes the doctor will give you pain medication through the IV after the surgery is over if you seem to be in too much pain. Obviously, having cuts in your stomach, that's going to have a degree of pain in itself. Um, if you're going to be laying down or laying on your back or even sitting up like you are now, after you have your surgery, if you take a pillow or something soft and put it on your stomach, and don't push hard, but just keep it on your stomach to where if you have to cough or sneeze, you've got some sort of barrier keeping those stitches in place to where it doesn't hurt or cause your stitches to break. Um,
My brother had this surgery a couple years ago, and he had lots of pain in his shoulder. If he's having a surgery on in his stomach area, then why would it hurt him in the shoulder?
well, when the doctor does a laparoscopic surgery like that, they have to insert a gas into your stomach to separate your abdominal wall from the gallbladder. And sometimes there's leftover gas in your stomach and it seems to settle in the shoulder. A way to kind of manage that pain is a rice sock, which is basically a sock that has got rice in it that you can heat in the microwave for about 30 seconds to a minute. And you just place that on your shoulder or a heating pad. That typically subsides within 24 hours. It could be a little bit longer, it might be less, you might not feel it at all, but that's how you would handle that. Do you have any other questions?
My friend is having a pool party this weekend, and I was wondering if I'm able to swim because I wanted to know if I could go.
Well, up until the point that your stitches are removed and the wound is completely healed, you should not submerge yourself in water, especially at a dirty pool, because that could be a problem. That's an opening for infection to get into your blood, and you don't want that. So, until the stitches are out and the wound's completely healed, swimming or hot tubbing or any taking a bath, any of that, you cannot do. You can shower, but do not submerge yourself in water until those stitches are taken out. So, if there's no other questions, then I think we've got you ready to go. Do you have any more questions?
No, man.
Okay, thank you.